If you sit for more than 6 hours a day after 60, your stroke risk doubles, even if you think you're healthy. That's not a guess, it's a proven fact backed by years of medical data. The silent damage of inactivity builds up in your blood vessels, your heart, and especially in the small arteries that feed your brain. I'm Dr. Jonathan Myers. After 3 decades treating stroke patients across the U.S., I've seen one clear pattern: people who move smartly age with strength. People who don't often face preventable strokes that change their lives forever. In this video, I'll show you 5 simple low-impact exercises that anyone over 60 can do to protect their brain. No gym, no heavy lifting, no excuses. Just movement that works like medicine. Let's get started. Your brain will thank you for it. Exercise is one of the most powerful tools we have to prevent stroke, yet it's completely free. When you move your body, you improve blood flow to the brain, lower your blood pressure, and reduce inflammation in your arteries. Regular movement helps control blood sugar and cholesterol, both major stroke risk factors. It also boosts your heart's efficiency, strengthens blood vessels, and supports healthy oxygen delivery to the brain. And just as importantly, exercise reduces stress and helps you sleep better, 2 often overlooked stroke triggers. For people over 60, the right type of exercise can literally act as medicine. And you don't need to run marathons. Even light movement done consistently can lower your stroke risk dramatically and help you live stronger, longer. Exercise 1. Brisk walking, the ultimate brain booster. If you can walk, you can prevent a stroke. Brisk walking is the single most accessible and powerful exercise for brain and heart health after age 60. It's low impact, requires no equipment, and can be done almost anywhere. When you walk at a brisk pace, meaning fast enough to raise your heart rate slightly but still allow you to talk, you activate your circulatory system. This improves blood flow to the brain, helps regulate blood pressure, and supports arterial flexibility. Multiple studies show that seniors who walk at least 30 minutes a day, 5 days a week, have a significantly lower risk of ischemic stroke, the most common type. Walking also helps lower LDL cholesterol, reduce blood sugar spikes, and improve your body's response to insulin. Here's how to make it count. Start with 10 minutes a day if you're new, and build up slowly. Use a comfortable walking shoe with good support. Walk on even surfaces, sidewalks, malls, parks to reduce fall risk. If weather or mobility is an issue, walk indoors or use a treadmill. Want extra benefits? Walk in the morning sunlight. This not only helps regulate your circadian rhythm and sleep quality, but also boosts your vitamin D levels, which plays a protective role against stroke. And here's an added bonus: walking also supports mental health. It reduces anxiety, boosts mood, and helps sharpen memory by increasing blood flow to the hippocampus, the brain's memory center. Even a 15-minute walk twice a day can dramatically change how your blood vessels function. So if you've been sitting most of the day, walking is your first and best move. Stroke prevention doesn't require high intensity. It requires consistency. Put on your shoes, take that first step. And remember, motion is medicine. Exercise 2. Seated marching, stroke-safe movement for limited mobility. If walking is too much too soon, don't worry. Seated marching is a simple, low-impact exercise that still delivers powerful stroke prevention benefits, especially for those with joint issues, balance problems, or limited mobility. Here's how it works. You sit tall in a sturdy chair, feet flat on the floor, hands resting on your thighs or holding the seat for support. Then, one at a time, you lift your knees in a slow marching motion, like you're marching in place, but seated. This movement may look simple, but it activates your leg muscles, engages your core, and stimulates circulation, particularly in the lower extremities, where blood clots often begin. By keeping your legs moving, you help prevent blood pooling, improve venous return, and lower your risk of deep vein thrombosis, DVT, a known stroke trigger. Here's how to do it properly. Sit up straight, shoulders relaxed, feet flat. Lift one knee at a time toward your chest, about 6 to 10 inches off the floor. Alternate legs in a smooth, steady rhythm. March for 1 minute rest, then repeat for 3 to 5 rounds. As you build strength, try increasing your speed or adding light ankle weights. Just a few minutes a day can improve lower body strength coordination and circulation without putting pressure on your hips or knees. Want to level it up? Add arm swings or gentle bicep curls using water bottles while marching. This creates a full body circulatory boost, raising your heart rate gently and safely. This exercise is especially helpful if you've been sedentary, are recovering from illness, or feel unsafe on your feet. Stroke prevention doesn't require intensity, it requires movement. And seated marching is proof that even while sitting, you can take a stand for your health. If you've got a chair and a few minutes, you've got everything you need to protect your brain starting today. Exercise 3. Wall push-ups. Build heart and brain strength. Without the floor. You don't need to get on the floor or even break a sweat to build strength and circulation. Wall push-ups are a fantastic way to improve upper body muscle tone, support cardiovascular health, and enhance blood flow to the brain, all from a standing position. This simple bodyweight exercise targets your chest, shoulders, arms, and upper back, helping to stabilize your posture and support heart function. But here's why it's especially valuable for stroke prevention. When you push against a wall, you stimulate vascular flexibility, promote arterial health, and raise your heart rate gently, which conditions your blood vessels to respond more efficiently to changes in pressure. Here's how to do it safely. Stand facing a wall at arm's length. Place your hands flat on the wall at shoulder height, slightly wider than shoulder width apart. Keep your body in a straight line, engage your core, and avoid letting your hips sag or stick out. Slowly bend your elbows and lean toward the wall, then push back to the starting position. Start with 2 sets of 10-12 repetitions, resting 30 seconds between sets. As you build strength, aim for 3 sets per day. If you want more challenge, steps slightly farther from the wall to increase the angle and resistance. What makes this exercise so important after age 60? Many older adults lose upper body strength, which affects posture and makes daily tasks harder. Poor posture can also compress neck vessels, impairing blood flow to the brain over time. Wall push-ups correct that. Even better, wall push-ups are joint-friendly, no pressure on your wrists, elbows, or shoulders. And since you're upright, there's zero fall risk. That makes this a great exercise for nearly every fitness level. So if you've got a wall, you've got a gym. And with just a few minutes a day, you're building not just strength, but stroke resilience. Let's move on. Exercise 4. Tai Chi or balance drills. Gentle movements. Big protection. If there's one type of exercise that blends movement mindfulness and stroke prevention, it's Tai Chi. Often called meditation in motion, Tai Chi is a slow-flowing practice that improves balance, coordination, and vascular health, all without stressing your joints. But even if you don't know Tai Chi, basic balance drills can deliver similar benefits. Why does balance matter for stroke prevention? Because poor balance increases your risk of falls, which is one of the leading causes of secondary strokes and head trauma in older adults. And beyond physical safety, balance training improves the brain-body connection, supporting the neural circuits that help regulate blood pressure, heart rate, and stability. Here's a basic Tai Chi-inspired balance drill you can try at home. Stand next to a sturdy chair or wall for support. Shift your weight slowly to one foot. Raise the opposite foot slightly off the ground. Just a few inches is enough. Hold for 10-15 seconds, breathing slowly. Switch legs. Repeat 5 to 6 times per side. For a gentle moving sequence, step forward slowly with one foot, arms rising gently as you move. Shift your weight forward, then slowly return and bring arms down. Repeat on the other side. Do 5 reps each side, focusing on slow, smooth movement. Practicing balance exercises like these for 5 to 10 minutes daily improves neuromuscular coordination, postural control, and even mental focus. It also reduces stress and cortisol levels, both of which are tied to stroke risk. If you enjoy structure, consider joining a local Tai Chi for seniors class or follow guided videos online. Even beginners feel the benefits quickly. In stroke prevention, it's not just about blood flow. It's about staying upright, stable, and calm under pressure. Tai Chi and balance training give you exactly that. Exercise 5. Resistance band training. Strengthen your arteries and muscles. You don't need heavy weights to build strength after 60. In fact, too much strain can do more harm than good. That's where resistance bands come in, one of the safest and most effective tools for stroke prevention and healthy aging. Why resistance bands? Because they stimulate your muscles and arteries at the same time. When you engage your muscles against light resistance, your blood vessels respond by expanding and contracting, improving their elasticity and overall function. This helps regulate blood pressure, reduce plaque buildup, and boost circulation to the brain. Here's a simple routine to get started. 1. Seated bicep curl. Sit tall in a chair. Step on the center of the band with one or both feet. Hold the handles or ends of the band in each hand. Slowly curl your hands toward your shoulders, keeping elbows close to your sides. Lower back down. Repeat 10-12 times. 2. Shoulder press. Sit or stand with the band under your feet. Hold handles at shoulder height, palms forward. Press upward slowly until arms are fully extended. Lower gently. Repeat 8-10 times. 3. Seated row. Sit on the floor with legs extended. Loop the band around your feet. Hold both ends. Pull the band toward your waist, squeezing shoulder blades together. Return slowly. Repeat 10 reps. These movements increase upper body strength, improve posture, and support the cardiovascular system, especially important for maintaining blood flow to the brain and preventing artery stiffness. Aim for 2 to 3 sessions per week using light to medium resistance. Rest between sets, breathe steadily, and never strain. The goal is consistent, gentle activation, not overexertion. And don't worry if you've never used bands before. They're inexpensive, portable, and easy to learn. Think of them as your lightweight insurance policy against stroke, frailty, and poor circulation. Strong muscles mean a strong heart and a strong brain. And with resistance bands, you can build both safely, 1 rep at a time. Doctor's tips for safe exercise. After 60. Before you lace up your sneakers or grab a resistance band, there's one rule I want you to remember. Exercise should energize you, not exhaust you. Especially after age 60, your goal isn't intensity, it's consistency, safety, and circulation. Start by checking with your doctor if you have a history of heart disease, stroke, balance problems, or joint pain. A brief consultation can help you avoid unnecessary risks and build a plan that works with your health, not against it. Next, always warm up before movement. This can be as simple as marching in place for a minute or doing shoulder rolls and ankle circles. It prepares your muscles and blood vessels for increased activity, reducing the chance of strain or dizziness. Stay hydrated. Dehydration thickens the blood and raises stroke risk, especially during or after exercise. Keep a glass of water nearby and take small sips before and after moving. Avoid exercising right after meals or when your blood pressure is unusually high. Mornings are often a great time to move. Your energy is fresh, and it helps set the tone for the day. And finally, listen to your body. If you feel lightheaded, excessively short of breath, or develop chest pain, stop immediately and seek help. These are not signs of progress, they're red flags. You don't have to be perfect. Even 10 to 15 minutes a day of safe, moderate activity can protect your brain, strengthen your arteries, and help you stay independent longer. Movement is not optional after 60, it's medicine. Use it wisely, and it will serve you for years to come. Stroke doesn't strike without warning. It builds silently through months or years of inaction. But the good news is, every step, every stretch, every small movement is a message to your brain, I'm protecting you. After treating stroke patients for over 3 decades, I can tell you those who stay active age with strength and dignity. You don't need fancy equipment or long workouts. Just 10 to 20 minutes a day of smart, safe movement can reduce your stroke risk more than most medications. If this video gave you something helpful, please like, subscribe, and share it with someone you love. You could be the reason they avoid a devastating stroke. Thank you for watching. Take care of your body, move with purpose, and never stop protecting your incredible brain. You've got this.